Chi Gung. Chi Gung is an ancient form of breathing that was developed by the Chinese over 4,000 years old. It's one of the concepts I cover in my book, Miracles Minutes, of a way to help restore people back to health and get their body functioning again. So when someone has a health issue or symptoms or pain, think about this. It's the only way that our brain and nervous system has a way of communicating to our conscious mind that we have a problem. So part of health, back issues and stuff like that has to do with autonomic nervous system. High blood pressure is a sign of autonomic nervous system malfunction. Digestive disorders are a sign of autonomic nervous system dysfunction. So instead of studying all the diseases, let's just talk about how the nervous system does work. And we'll talk a little bit about Qigong. So breathing is one of the first things we do. We inhale. When we first get here, is the baby okay? Are they breathing? And then what's the quality of that breathing? What's their APGAR score? What's their facial color look like? What's their tonality? But what we're going to talk about is deep breathing and helping you get reconnected to that. So we're going to cover a little bit of concepts of how it sort of works, because there's some uniqueness to Qigong breathing style that's going to seem a little weird to the Western-minded person. But I'm going to help you contact to that or get in touch with that real quick. So you want to breathe through your nose, because you breathe through your nose, it signals to your brain that you're going to use your diaphragm. So that's, or be a little bit more proficient recruiting the diaphragm. I recommend that you learn this laying on your back with your legs above a chair. This is how I teach it in my office. It's the easiest way to learn it. It's kind of how we started out as babies. We laid on our back, our legs were up in the air, so it's a quick way to connect to it. Now, when we're babies, the other thing we had to do was connect or learn to not pee our pants and not to poop our pants. So there's two fascial sheets that are located in the pelvis called the urogenital diaphragm, and there's another one back by the anal sphincter. They're actually hardwired into the spine and into the nervous system that go directly to these breathing centers, which is pretty fascinating. So if we look at the spine, we can look up top here and the pelvis being down here, and these fascial sheets kind of connect the front and back of our bodies of the not peeing our pants and also not pooping our pants. So anyway, you can think about the body as this whole area, the torso, as a piston. The diaphragm sits up here, it moves up and down. As it goes down, air comes into the lungs. When it goes up, air goes out. Now, we need to create pressure, and we do that by closing these fascial sheets. So when these fascial sheets close here and the diaphragm comes down, pressure builds in the abdomen. It gives a good squeeze to our organs, so that way they stay healthy. So there's a system, and I talk about this in my book, Miracles in Minutes, of blood comes in, blood goes out, in and out. The tide comes in, the tide goes out, in and out. Air comes in, air goes out, in and out. Food comes in, food goes out, in and out. So we just see this pattern of in and out. So what I'm trying to say is here, when that diaphragm comes down and you have pressure at the bottom and the diaphragm comes down, it actually causes squeeze to all your abdominal organs and viscera, where you can kind of squeeze them like a sponge to wring them out and let new water flow in. So this is one of the benefits of Qigong. It keeps our body really healthy, and Qigong also started a lot of the martial arts. So what you're going to do is you're going to lay on your back. You're going to breathe in. You think about breathing down to your butt, or there's actually an area called the perineum between your genitalia and your anal sphincter. And as you breathe down towards that area, do not force it down in the beginning. It's going to take some time because you're probably not used to breathing like that. But before you take the inhale, what you want to do is close your anal sphincter, pull, or do like a Kegel exercise, like trying to stop urinating, and then inhale through the nose. And as you do that, you may feel a little weird. So for some people, it chokes up their breathing. I'd recommend turning off those two locks and just get your breathing down first. Slowly, you can bring one lock in, or maybe just trying to imagine stop urinating and breathe like that. Then try to close your anal sphincter and stop urinating at the same time and breathe that way. And that'll create that pressure at the bottom, and you'll start to feel a lot different. Your brain will really calm down. You'll feel very relaxed, and it makes your spine very stable. So if you're ever having any health issues, if you start practicing Qigong, start slowly. Sometimes you need to see a practitioner who teaches this. But as you start doing it, your health can really turn around. It's an internal exercise. It's internal energy development. It's different than athletics. All athletics is built upon the quality of your breathing to start with. So I hope this helps out. Enjoy your day.